Hi, everyone. I'm George Stephanopoulos from ABC News. Our system of democracy is unique. Citizens can influence and ultimately control virtually all of our nation's policies, and for more than 200 years, it has worked. Coupled with our free enterprise economy, Americans enjoy a high standard of living. Countries all over the world have tried to copy us, and tens of millions have flocked to our shores to enjoy our benefits. In this video, we take a look at where we stand as Americans, at how Americans' health and well-being compares to other countries. We're also going to examine the choices we make that impact our health and well-being.
To better understand all this, we'll look at some of the health-related subjects considered by our nation's policymakers. First, we'll look at the percentage of Americans who live to the age of 5 as compared to those in other nations, our access to emergency medical care, and our position in the world in terms of medical research and innovation. We'll also look at the choices that influence our health and well-being, such as drugs, including alcohol and tobacco, cancer, obesity, sexually transmitted diseases, auto crashes, and education and income level. Now you will hear from the person who is helping make this video possible in your area.
Nobel Peace Prize winner and American champion for social issues Jane Addams once said, "The good we secure for ourselves is precarious and uncertain until it is secured for all of us and incorporated into our common life." My name is Kathy Crendel, and I serve as president of Otterbein University, one of the most innovative and socially responsible private universities in the country. Otterbein is located in the heart of Ohio, just minutes from downtown Columbus. As a values-centered institution, I can tell you that since our earliest days, the people of Otterbein have asked, how does what we do enrich and improve the quality of life in our community? One of the most critical needs that our nation's universities can help address, beyond access to an affordable and quality education, is providing for and advancing the wellness and health of our communities. As the nation's experts ask themselves how to prioritize and address the major public health concerns in the United States, one thing has become clear: the ability to get individuals to act on even just one indicator of health promotion and disease prevention can have a profound effect. Otterbein University nurses and students from more than 18 health-related programs are prepared to stand out in their professions and make a difference in the communities they serve. One of the reasons this happens with such impressive regularity is because Otterbein believes students should have hands-on experience from the very beginning of their studies. Otterbein nursing program students are applying their knowledge and skills in clinical experiences, internships, and other experiences in more than 250 contractual sites that range from large, complex health systems to extended healthcare facilities, primary care, and specialist offices, as well as schools and public health clinics. In addition, they are working with engineering students in our new STEAM Innovation Center on innovative ways to improve their work. Together, they recently created a marketable healthcare simulation station, which includes a tablet, simulated thermometer, and pulse oximeter. This new tool allows students to take action to obtain data and determine what metric is needed to assess the patient for accurate information. These critical thinking skills will be invaluable once they are out in the field. Health and sports sciences students take their knowledge into real-world settings by working with hundreds of citizens from all age groups on fitness and nutritional health. This commitment ranges from exercise science majors working with our local senior center to address their fitness to nutritional health and wellness mentoring and guidance offered to elementary school children who face food insecurity. Otterbein's health and sports sciences students also fine-tune and enhance their learning with clinical placements through impressive internship sites that range from major corporations to health systems to community-based public health entities. Otterbein's campus community also benefits from health and wellness issues spearheaded by these talented majors. Employees are able to get individualized fitness programs designed by our health and sports sciences majors. There has never been a more important time to consider a career in health and wellness. The demand for nurses, for example, is projected to grow significantly as new payment systems support new and expanded roles of nurses in the healthcare system. In fact, at Otterbein, employment rates are near 100% as our nursing graduates enter the profession through a myriad of opportunities. Nurses, athletic trainers, and allied health graduates will truly serve as our country's boots-on-the-ground professionals who stand to make the biggest difference in the lives of those for whom they care. In closing, many students come to Otterbein for a dynamic first-class education. We offer many programs outside of the healthcare fields. All students leave here discovering they have the knowledge, skills, and values that empower them to serve as leaders in their chosen fields or life's passion. From developing new protocols, simulations, treatments, and understanding health promotion and disease prevention, to advising and advocating at a local, state, national, and international level, Otterbein Health majors stand strong in their commitment to excellence and impacting future generations. Otterbein University stands ready to help you become a top-notch health professional.
You live in the United States, but you could just as easily live in another country like Chile, Niger, or China. How would your health and well-being be different if you lived in another country? To better understand this, consider the issue of the likelihood of living to the age of 5. Only about 1 out of 100 Americans will not survive until their 5th birthday. In Haiti, in the Americas, 7 won't survive, and in Sierra Leone, in Africa, 19 out of 100 kids won't live to the age of 5. Just living in a country like the United States significantly increases your chances of living beyond the age of 5.
Now let's look at America's emergency medical care. Imagine your friend or family member was injured in an accident. What would happen next? If that person lives in America, he or she will most likely be receiving medical care within a hospital within 45 minutes. That's because nearly 94% of accident victims in America, regardless of their economic situation, are in a clean, well-equipped emergency facility within 45 minutes. Most people around the world are not that fortunate. 85% of the world's population do not live in a high-income country like the United States, and therefore they do not enjoy the same access to emergency medical care that we enjoy. Even in Mumbai, the wealthiest city in the middle-income country of India, only 1 out of 10 accident victims receives transport by ambulance, and nearly 1/3 of all accident victims die due to delays in transportation to medical facilities.
Now, let's hear from an expert on where America stands in terms of medical research and innovation.
I'm Dr. Francis Collins. I'm the director of the National Institutes of Health, NIH, in the United States. I'm a physician, a scientist. I had the privilege of leading the Human Genome Project, and I'm here to talk to you about medical innovation, and particularly the way in which America has played a leading role in that enterprise over many decades. Right now, innovation in medicine is at a fevered pitch. We have the human genome to help us understand how life works and how sometimes disease occurs. And there is a great deal of energy and excitement about innovations around those discoveries to lead us to new ideas about how to prevent, treat, and cure disease. America, the United States, has been in a very remarkable role for several decades because of the investment the taxpayers make through the Congress in supporting medical research. So the NIH, which I lead, is the largest supporter of biomedical research in the world. And the consequences of the work are pretty amazing. If you just want to count up, for instance, publications, more than 1/3 of the publications about medical research right now in the world come from the United States. The development of new medicines, about 1/3 of those come from work done in the US. We could count Nobel Prizes, I suppose. That's a pretty good indicator of where success has happened. 84% of Nobel Prizes are given to groups or individuals that include at least one American. The NIH has supported individuals who won the Nobel Prize now 138 times. But of course, it's also really important for people to take all the right steps themselves to focus on staying well. And it's interesting and somewhat disturbing to notice that 40% of illness in the United States actually comes about because of unhealthy practices that we each choose or don't choose. So as you listen to all of the information in this segment about America's health, I hope you'll both be excited about where it's taking us, the great advances that we're on the cusp of achieving, but also it'll motivate you to make those decisions yourself about diet, about exercise, about other health practices that will keep you healthy for many decades to come. That's our collective goal.
As Dr. Collins said, the United States is a world leader in terms of medical innovation and research. This is in part due to the commitment our democratic government makes to this subject area. With that, and our access to top-of-the-line emergency medical care, Americans live the longest, right?
Unfortunately, the data show that Americans are actually sicker than people in other high-income countries. We have one of the largest economies in the world. We spend more on healthcare than other countries do, and yet we live shorter lives and have higher disease rates than people in other rich economies. This has been true for many years now. In fact, since the 1980s, this situation has been getting progressively worse. Americans' health is just not keeping pace with the health of people in other high-income countries. Men live on average 5 years less than people in other high-income countries, the OECD average, and women 3 years less. This is a pervasive problem in the United States. Our teenagers have higher disease rates than teenagers in other countries. Death rates at all ages up until age 75 are higher in the United States than in other countries. And we see it affecting a wide variety of diseases, chronic diseases such as diabetes and heart disease, deaths related to obesity and diabetes, and also deaths from injuries, nonviolent injuries, and violent injuries as well.
America actually ranks last on all these health and wellness measures compared to the 16 other high-income countries. What do many of these statistics have in common? They're a result of negative choices Americans make. That means it's more likely we won't live as long as we could.
We lead the world in caloric intake. No other population in the industrialized world consumes as many calories per capita as do Americans. Our injurious behaviors, behaviors that make us more prone to injury, are distinctly different in the United States. American motorists are less likely to wear seat belts. Motorcyclists are less likely to wear their helmets. We are more likely to use drugs that are dangerous to our health, and we have higher drug death rates as a result of that. And then, of course, civilian firearm ownership is much higher in the United States than in other countries. When we looked at the health of American teens, we were very disturbed to see, first of all, that their life expectancy is shorter than teenagers in other countries. They are more likely to die of car crash injuries and from violent injuries like gun-related incidents. They also have higher rates of obesity. They have higher rates of sexually transmitted diseases. They have higher rates of HIV. The highest rates of unwanted pregnancy in the industrialized world are in the United States.
Living in America gives us a far better healthy starting point than most other people in the world. But compared to the other highest income countries, we don't fare so well. Many of the personal choices we make keep some of us from living long, healthy lives. It's a little like being surrounded by the world's most modern exercise and athletic training equipment. That alone does not make us strong, well-conditioned athletes. We have to use the equipment and exercise on a regular basis.
So let's look at 6 topics related to health and well-being. See where we stand as Americans compared to the rest of the world, and examine some of the ways that our personal decisions impact our health on these matters. First, alcohol, drugs, and tobacco. According to a survey, about 27% of American teens drank alcohol during the previous month. The European countries averaged twice the U.S. rate. 24% of Americans over 12 had binged on alcohol in the previous 30 days. That's 5 or more drinks in a 2-hour period. Why is that important? Because binge drinking is especially harmful to the part of the brain which plays a critical role in learning and memory. And alcohol abuse has other unintended side effects: car crashes, unwanted pregnancies. Even one underage drinking or disorderly conduct charge can make it harder to get a job, a car, or a scholarship. And of course, the same negative consequences can happen when you use illegal drugs. Americans use twice as much marijuana as almost every European country. But what about the drugs you find in your medicine cabinet? Prescription drug abuse is a problem in many areas of the world, but they're legal, so many people assume they're safe to use. That's not true. Among American teens, prescription and over-the-counter medicines account for most of the commonly abused illicit drugs. Many incorrectly think, if I take it from the medicine cabinet, how bad can it be? And don't realize how addictive and dangerous these medications are. A drug overdose can happen the first time you take something, and even if you take the same amount that you've taken before. It happens all the time, and it doesn't matter how healthy you are. Few realize that harmful side effects of alcohol and drug abuse can include cancer, liver disease, memory loss, depression, mental illness, heart and respiratory failure, and even death. By now, it shouldn't be news to you that smoking is bad for your health. What you may not know is that it was public policymakers who took actions that drastically reduced smoking in America, such as labeling cigarette packs and banning smoking on airplanes, among other things. Tobacco is the world's leading single cause of death. Cigarette smoking alone is directly responsible for approximately 30% of all cancer deaths in the United States each year. But cigarettes are not the only tobacco products that can negatively impact one's health. 19% of American 12th graders had smoked with a hookah in the past year. Among college students, hookah use is even greater, with 40% having used a hookah. Many don't realize that hookah smoking puts you at risk for the same types of diseases caused by cigarette smoking. According to the Centers for Disease Control, 1 hour of smoking a hookah is equivalent to smoking 100 to 200 cigarettes. So how do Americans compare with respect to cancer? Cancer is the second leading killer of Americans, yet, according to the Centers for Disease Control, at least 1/3 of all cancers can be avoided through prevention and another third through early detection and treatment. Melanoma, a form of skin cancer, is the second most common form of cancer in young adults, ages 15 to 29. A person's risk of the potentially fatal melanoma doubles if he or she has had 5 sunburns at any age. As well, first exposure to tanning beds in youth increases one's melanoma risk by 75%. You can significantly reduce your chances of having cancer by avoiding tobacco, limiting alcohol use, avoiding excessive exposure to ultraviolet rays, eating a diet rich in fruits and vegetables, maintaining a healthy weight, and being physically active, which means trying to exercise 30 minutes a day. As well, having age-appropriate screenings can help prevent cancer, as can certain vaccines. Let's compare the U.S. to other countries in terms of our cancer incidence and death rates.
Technology has improved our lives in many ways, but it can have a negative impact on our weight and fitness. You can order things online without having to go to the store. You can play video games and even see your friends online without leaving the couch. Technology also saves time with pre-packaged and fast food, but that means that Americans are eating more calories and more food with lots of sugar and fat. All of these things impact one's waistline. It's important to remember that being obese or overweight is not just a cosmetic issue. It increases your risk of heart attack, diabetes, and some forms of cancer. In fact, severely obese people die 8 to 10 years earlier than those of normal weight. Healthy eating and exercise can decrease this risk factor. America is one of the most overweight and obese countries in the world. 34% are overweight and 32% more are obese, but fewer than 10% of Italians and French and fewer than 5% of Japanese people are obese.
Okay, how do Americans compare with regard to sexually transmitted diseases, or STDs? Nationally, half of all sexually active youth will contract an STD by the age of 25. Although most STDs are treatable and not life-threatening, they are not a minor matter. They may result in other serious health problems, including infertility, birth defects, increased risks of some types of cancer, and the increased risk of the transmission of HIV. AIDS continues to kill millions around the world, and many right here in the United States. The U.S. has the highest incidence of AIDS among other high-income countries. Let's see how our HIV infection rates compare with other countries.
Hello, I'm Officer Aubrey. You know, I see something on the roads every day that most teenagers cannot wait to get their hands on: a car. Did you realize that the United States has the highest death rate among the 17 wealthiest countries when it comes to transportation-related accidents? In 2012, over 32,000 Americans were killed in fatal highway crashes. 1/3 of those crashes involved alcohol. 16% of those crashes involved distracted drivers who were either talking on their cell phone, texting, or talking to the passengers next to them. Americans also wear their seatbelts less than people in other developed countries. For teenagers, the automobile is one of the greatest threats to their lives. But by driving carefully out there, keeping impaired people from behind the steering wheel, wearing your seatbelt, and most importantly of all, pay attention to all the traffic control devices out here. Those things will greatly reduce your chances of dying in an automobile accident. You folks drive carefully out there now.
Finally, let's look at one additional topic that can literally change your life and your long-term health. As you have seen, there are a large number of different steps that you and your fellow Americans can take to have a healthier life. But health experts agree that one issue, education and income level, will most impact your chances of living a long and healthy life.
We've had the highest child poverty rate of all the industrialized countries since the 1980s, and it's getting worse. Income inequality rates have been rising since 1968 in the United States. So now the gap between the rich and the poor is extremely wide compared to what it was in prior years. This has been happening also to some extent in other modern industrialized countries, but not to the degree that we experience here in the United States.
If America's overall health is going to improve, so must its overall education and income level of its poorest citizens, focusing them on steps to lead them out of poverty.
American seniors are more likely to have had a college education than older adults in other countries, but our young people falling behind young people in other countries.
Did you know that the life expectancy of a 25-year-old American who dropped out of school is about 9 years shorter than one with a college degree? And that a college graduate, on average, earns nearly $1 million more over a lifetime than someone with just a high school diploma.
Those people who have a more advanced education are the ones who are able to get better jobs, jobs that have health benefits like health insurance coverage and other benefits, but also higher earnings that allow them to earn the kind of money that allows them to afford a healthier lifestyle, to live in healthier neighborhoods, to purchase a home in communities that have an environment that promotes physical activity, to pay for gym memberships and other expenses that are part of living in a healthier way. Much higher rates of disease that exist for people with limited education, unhealthier behaviors such as smoking and obesity, diminished physical abilities. So workers who have not graduated from high school have less ability to lift heavy weights or to stand for significant durations of time. So higher disability rates, decreased work productivity, higher rates of mental illness and psychological distress. All of these factors are known to be related to education. Education is important not only in terms of improving our economic well-being and our livelihood. It's important, obviously, for American businesses to remain competitive with companies in other countries in a very competitive marketplace, but it affects also our health, the health of our children, and ultimately our healthcare costs. Because if education means we have lower disease rates, it also means we have lower costs for caring for those diseases.
A very important new discovery by the Brookings Institute found that even modest education is a path out of poverty and into improved health. It determined that young people can virtually assure that they and their families will avoid poverty if they follow 3 elementary rules of success. 1, complete at least a high school education. 2, work full-time. And 3, wait until age 21 and get married before having a baby. People who follow these 3 rules have a 2% chance of living in poverty and a 72% chance of joining the middle class, defined as having a family income of $55,000 a year or more. So, in summary, where do we Americans stand with respect to our health and well-being? On average, we are better off than the vast majority of the world's people. In fact, as an American, You have a life expectancy rate at birth that is better than 90% of the world's population. Even Americans that are among the poorest 10% of our population have a life expectancy rate that is better than 60% of the people in the world. But remember, American health is no longer the best of the best. Among the 17 wealthiest countries, America now ranks last in the areas of health previously mentioned. And unfortunately, the trend indicates that our rank in the world in terms of health will fall farther and farther. You can do your part to reverse this and make America and yourself healthier by making many of the lifestyle changes mentioned in this video. You will now hear from the person who is constitutionally elected by the people from your part of the state to represent your interests regarding health and other important issues in our nation's government in Washington, D.C.
My name is Pat Teaberry, and I proudly serve Ohio's 12th District in Central Ohio, where I've lived my entire life. As a member of Congress, my top priority is to listen to my constituents and fight for solutions to help our communities grow and thrive. I serve on the House Ways and Means Committee and the Joint Economic Committee, which gives me the opportunity to work on issues that impact everyone, like taxes, trade, and our nation's entitlement and healthcare programs. Every day, I'm getting focused on getting things done and delivering results that people like you can count on, from reducing our national debt and deficit to fostering a better environment to grow our economy. We have some challenges and opportunities ahead, so it's vitally important to me to hear from you. I invite you to contact me or my staff by visiting my website, tberry.house.gov/contact, or calling my office to express your concerns on the issues that matter most. Thank you, and I look forward to hearing from you.
So where do you stand as an American? Each one of us is provided with a whole lot more than most others in the world. Our standard of living here makes us among the lucky ones, and with the right choices, we can enhance our health.
So one of the factors that is especially important to the health of Americans is their education. We already know that a good education is important. We live in a knowledge economy where one's ability to get a good job and to earn a nice salary is very dependent on getting a college degree or an advanced degree. But we often forget about the fact that it's important to our health. People who graduate from high school, get a college education, have longer lives, longer life expectancy, and lower disease rates than people who have less of an education. I think we all intuitively understand this, that people who are more educated would be in better health, but I don't think we realize how big a deal it is. We're talking about a 9-year difference in life expectancy between people who have not graduated from high school and those with college educations. Much higher rates of disease that exist for people with limited education. Unhealthier behaviors such as smoking and obesity, diminished physical abilities. So workers who have not graduated from high school have less ability to lift heavy weights or to stand for significant durations of time. So higher disability rates, decreased work productivity, higher rates of mental illness and psychological distress. All of these factors are known to be related to education. So education is important not only in terms of improving our economic well-being and our livelihood. It's important, obviously, for American businesses to remain competitive with companies in other countries in a very competitive marketplace. But it affects also our health, the health of our children, and ultimately our healthcare costs. Because if education means we have lower disease rates, it also means we have lower costs for caring for those diseases. Therefore, an improved education is actually a strategy for helping to bend the cost curve and control the rising costs of healthcare. It's a basic strategy for trying to cut off the flow of disease into the healthcare system. The amount of impact of education on health is huge. To give one example, diabetes mortality rates, the risk of dying from diabetes, is 3 times higher if one has not graduated from high school than if one has at least some college education, not even a 4-year degree. 3 times higher. As a doctor, I can tell you there's very few things we can do in the hospital or doctor's office to achieve those kind of results in managing diabetes. And yet diabetes is a major killer in this country, and it's a very expensive disease that's of great concern to government and to employers because of the hugely substantial increases in the cost of health care that are coming from diabetes. So if we're wringing our hands trying to figure out how to control the rise in health care costs, along with health care reforms like the use of electronic medical records and changes in the reimbursement of doctors and other strategies that are currently being proposed to control the cost of health care, why not prevent the diseases from occurring in the first place? Why not cut off the flow of disease into the system by something as beneficial as improving the education of our young people? So when we think about why it is that people with limited education have worse health, there is a tendency sometimes to jump right away to what's happening in schools for students. So for example, is it true that people who have less education have worse health because of the quality of food in the school cafeteria or how much physical activity there is in the curriculum? Or maybe it's because they didn't go to class and learn that smoking was bad for your health. School wellness is important, and those components of the curriculum are obviously important public health priorities, but we understand that the reason why people with limited education have worse health has a lot to do with what we call the downstream benefits of an education. Those people who have a more advanced education are the ones who are able to get better jobs, jobs that have health benefits like health insurance coverage and other benefits, but also higher earnings that allow them to earn the kind of money that allows them to afford a healthier lifestyle, to live in healthier neighborhoods, to purchase a home in communities that have an environment that promotes physical activity, to pay for gym memberships and other expenses that are part of living in a healthier way. But there's also a need to remember the upstream factors that affect the relationship between education and health. And by upstream, I'm referring to things that happen to kids before they even reach school age. Imagine you're a child who grows up in a stressful environment, an unstable family or a difficult neighborhood. That child coping with the stress of growing up under those conditions may be more likely to take up unhealthy behaviors that will end up creating a life of disease later as an adult. So for example, they might take up smoking or drugs, or they might start hanging out with the wrong crowd and get involved with crimes and therefore be at risk for violent injuries. The behaviors they adopt may later be responsible for them having higher rates of obesity or heart disease or diabetes. Oh, and by the way, they don't do well in school. So you end up with a correlation between education and health, but the root causes are much earlier. And some of them are way earlier because some of those stressful experiences they endured have to do with the problems their parents experienced in the years leading up to having their children. So there is even a transgenerational effect that explains some of this relationship between education and health. The policy significance of thinking about all of these potential explanations, the factors at school, the factors that are downstream benefits, and the upstream factors, is that we're not going to solve this problem unless our policy solutions address all three areas. We need to make schools healthier places. We need to promote good jobs and higher earnings and address the challenging economy that the poor and middle class are currently facing. But we also need to institute policies to deal with those upstream issues: early childhood education, support for parents with young children to help provide a more supportive environment for raising young children, and to create nurturing, healthy environments for our young people so that by the time they reach school age, they're set up for success.